So in 2013, we started with a concept, and the concept was that we wanted to link multiple sclerosis centers from coast to coast and in between, and tried to capture the natural history of multiple sclerosis in the disease-modifying era. And it was a monumental task and an expensive task, and we approached every pharma from this country that has an interest in multiple sclerosis. And fortunately, every one of them thought this was a great idea and collaborated and provided the seed money and the support money for the first 5 years. And that's how we got started. And the goal of this project was to link up MS centers, both academic as well as private practice setting that see a lot of MS patients. Each center will contribute about 50 patients for a total of 20 to 25 sites for a total number of 1,000 plus, probably about 1,200 patients. And about 5 centers out of the total centers will be from Canada. And I'm happy to say that at this point we have recruited 21 sites out of the 25. And one of the sites is Saskatchewan from Canada. And we are now at the halfway point. About 500 patients are in the trial, in this registry. So we decided to look into the data to see if we can actually start mining the information that's in there to get an idea about how useful is this registry. And one of the cores that we had launched is the Health Economic Outcome Research core. And this core uses a standardized, validated instrument that is very familiar to the industry, and they brought that to us, and we incorporated that with the rest of the case report forms. And we started from day one collecting economic information related to multiple sclerosis. And that's basically what we're going to be presenting this afternoon, where about 480 subjects provided information, and it had everything to do with their demographic information, the information about their disease state, their level of disability, their living situation, and their work and their home situation. And the cohort is a relatively early cohort because we have inclusion criteria that restricts us to within 10 years of illness onset, which has now been made to 15 years. And when we got started, it was within 50 years of age, which is now extended to 60. But most of the patients in this registry are in the younger age group and relatively mild in disease. What was interesting was that in spite of the fact that you're looking at an early cohort and a relatively mildly impaired cohort, there was significant impact of the disease on their work. 77% of the subjects were employed. But one of the things that became apparent was that about 25% of the 77% that's employed was underemployed, which basically means that they would have liked to work full-time, but they had to cut into part-time. About 13% of the total cohort were already on disability. And when we look at how it is impacting their work and how it is impacting the home, because the home is just as important as the work, and some of these people are not necessarily working outside the home, they're homemakers, what we find is that there is a significant impact at home as well. So it's a disease that seems to impact not only the work environment, but also the home environment. And when we poll them for what is their main reason why they're not able to function, it's not because of disability of gait or immobility, but it is difficulty related to fatigue. And as we all know that fatigue is one of the most common symptoms that a patient with MS experiences. And the number 1, 2, and 3 as far as the patient was concerned was fatigue, severe fatigue. that precluded them to carry out a full 8-hour day in some instances, or not to be able to work at all. The second most prominent impairment was related to cognition. So these are what we call the silent or the transparent symptoms of multiple sclerosis. These are people who have these impairment. They can walk, they are not impaired in their gait, they can use their hands, but the most important part of them, which is their ability to think, ability to multitask, ability to focus, ability to remember, those functions seems to have become affected. And this is something that we have recognized for a long time, that cognitive impairment is not a delayed consequence of multiple sclerosis, but actually an early phenomenon. So it's a combination of fatigue, which actually worsens their cognitive impairment, and on top of that, independent cognitive problems that contribute to the difficulties. So there is also another side to the economic impact, which is the indirect consequences of multiple sclerosis. This was just a first stab at the data. We never really got into how much is the caregiver affected, how much is the spouse affected, how many days of work does the spouse lose as a consequence of the patient's difficulties, how much difficulties do the couple have in bringing up children, is there other responsibilities at home that the individual is not able to fulfill. So what we just looked at was the direct impact of MS in employment of the subject, but it goes much more than that. And we hope that we will be able to get into the nuts and bolts of this and see, what is the impact of treatment. For example, if somebody was on treatment versus somebody is not on treatment, does the person who's on treatment do better than the person who has not chosen to go on a disease-modifying agent? So there's a lot more work to be done, but this is the first stab. And basically what we saw from this first look was quite remarkable, that even though it's only 13% of the subjects are on disability, even the people that are working, 25% of those are working, are underemployed and not realizing their full potential because of the problem directly related to multiple sclerosis. So we have a long way to go.